Hi everyone, I'm here to share a resource that I use at my externship site. I'm at Transitions of Long Island, which is a rehabilitation center, and it's an outpatient rehab for those with neurological impairments. So something I want to share with all of you is an internal memory strategies acronym. And so this acronym CRAVE that I use is helpful to facilitate recall, whether in word length information, sentence length information, or even paragraph length information. It's important to know that the level of information you'll use with the patient, it really depends on the patient themselves. So I've used this to delay recall of words, sometimes sentences, and even paragraph level information. So to get into this acronym, as I mentioned, the acronym is CRAVE, and each letter in CRAVE stands for a different internal memory strategy that helps to facilitate recall. So the C in CRAVE is chunking, and that's breaking down large information into smaller information. This is something that we might do every day with the telephone number. So you have all the numbers, but it's broken down into the area code, the first three numbers, and the last four numbers, and that's chunking. Then we have repetition. And repetition is just simply repeating the word, phrase, sentence, or even details from a paragraph. It's important to note that if the patient has trouble producing speech themselves, you might simply just repeat it for them and have them listen a few times of the information that you want them to recall. The A in CRAVE is association, and that's relating new information to old information. So for instance, if you were talking with a patient about a dog and you want them to remember the word dog, they might relate that word to factors of their dog they have at home or a person's dog they know. So it's relating the new information of the word to old information that they have within their memory. The V in CRAVE is visualization, and this is just creating a mental picture. So if you're having them remember details about something outside, they might create a mental picture or explain to you or just think about them being outdoors. The E in CRAVE is elaboration, and that just stands for talking more, making a big deal about the topic. So if you give them a word or a sentence, they just are going to elaborate or add more on the topic to help them recall the information either immediately or at a later time in delayed recall. So it's important to note that when you're using this with patients, that you have to realize the cognitive load that this might put on them. So sometimes only a few strategies in the acronym CRAVE will help the patient, such as repetition or elaboration. Sometimes the patient, if they're at a higher cognitive level, they could actually remember the acronym themselves and use it in different memory tasks. But a lot of the time I facilitate memory with the patients by choosing which one we think would work best. And most frequently I've used repetition, association, and elaboration. So 3 of the letters in CRAVE that help them to recall information. And it's shown to be helpful as a compensatory strategy because these patients have difficulty in memory due to their previous etiology, but using these strategies have helped them to recall information even at the end of a session with me. So again, using the acronym CRAVE, so chunking, repetition, association, visualization, and elaboration, that's 5 different internal memory strategies that have proven as compensatory strategies to help patients facilitate recall of information. And I hope that some of you can use this in your future and help patients with delayed recall.